1140 WRVA and Doc Thompson. My guest, Senator Mark Warner. How are you, sir?
I'm fine, Doc. How are you doing?
Doing fine. The main reason I want to speak with you is because of all the healthcare whirlwind in D.C. So we're going to jump right into this. Why is Congress even worried about changing our healthcare system right now? I mean, we've got so many other fish to fry.
Well, Doc, here's why I think everybody, not just Congress, but America should be worried about taking on healthcare is the current healthcare system is not sustainable. The biggest driver of our federal deficit, and I'm a big-time budget hawk, is not education spending or transportation spending, it's healthcare spending. Medicare and Medicaid are going to explode the deficit over the next 10 years. If we don't do anything, if you've got private insurance, you're going to see your premiums double over the next 10 years. American business can't compete when we got to pay $3,000 more per employee for healthcare costs than any of our competitors around the rest of the world. Now, it doesn't mean you've got to do it tomorrow, but it means if you don't take on healthcare reform, I think we're not going to see a full-fledged economic recovery, and I also think we're going to explode the deficit. And that's just not sustainable.
Well, you say not tomorrow, but that's all we're hearing is we got to do this now. That's what's coming out of Congress and the president.
Well, Doc, I'm not sure I agree with it. I do think sometimes setting arbitrary deadlines doesn't make a lot of sense. But there are folks on both sides of the aisle who've been working on health care in Congress for years. I've been working on health care for 20 years. I started the Virginia Health Care Foundation 20 years ago. I completely revamped our children's health insurance program in Virginia. We got named the best in the country when I was governor. I grappled with Medicaid costs, which was a big driver of our state budget.
Well, yeah, we know all these things have come up for a while. There's a lot of people on it. But recently, I mean, these bills were thrown together, and most of Congress never read them.
Well, I can't speak about other members of Congress. I can only tell you that on the Senate side, we don't even have a bill out yet. We don't even have a bill that can be read and reviewed and what have you. I do think, that we need a full debate. I do think that folks, ought to see the good, bad, and the ugly on these proposals. I think that's going to be happening over the next couple of months. And, as I know you know, Doc, and I know most of your listeners know, even if the House passes something, the Senate passes something, then you got to go to conference and the president can amend it. I mean, we're looking at health care continuing to dominate our agenda for many months to come.
Do you support a public option as part of this?
Listen, I don't think...
a government sponsor.
Let me just say, I think we ought to have... You got to have competition. I'm a big believer that what we've got in this country right now is a part public system with Medicare and Medicaid and the VA, and then a part private system. I want to keep a more private-based system. I also, where I start with healthcare reform, and probably different than most of your callers or most of the Democrats or Republicans, is I believe that what's going to drive this is we got to drive the cost curve down. We have healthcare costs that are twice as much as any other industrial country in the world. What I'm going to be looking for in reform is how we drive the cost curve down. And a public option that simply is expanding existing Medicare and Medicaid to more populations, that doesn't drive the cost curve down. So, no, that's not an approach I think that makes sense.
So, but you do want some sort of public option then?
No, Doc. What I said was I want some competitive alternative. I'm anxious to take a look at what this co-op plan might look like that says if you've got an area of the country that doesn't have any kind of competition, can you set up some not-for-profit co-op? Could you end up perhaps looking at, where healthcare reform has really been taking place over the last couple of years, is a lot of our large corporate employers around this country have really been very efficient at driving down their healthcare costs because they reward people for good behavior.
Okay,
they reward people for, let me answer your question, Doc. They reward people for good incentives. Having some of those competitive plans out there, it can be a private-based plan as long as you've got some competition.
Okay,
I'm a free market guy.
I understand you're a free market guy. You're a businessman. You were very successful in business, but you have to understand. You really don't expect me to believe that you as a businessman and a free market guy think that a public option or even a co-op where the government starts it up and has to put seed money out there is true competition. That's not competition.
Well, if you've only got one insurance provider in a market and you've got a pure monopoly system, that's not competition as well. I'd much rather see private-based competition. But if at the end of the day, the co-ops that I've seen around the country, some of them have done a halfway decent job. Now, remember, Doc, one of the things that I think has been missed in some of this debate is we hear about folks saying, well, we don't want government interference. Well, you've got government interference in healthcare already in Medicare and Medicaid. And you've already got government interference in healthcare right now with anybody that shows up in the emergency room who's uninsured. If they get taken care of, the government's footing part of that bill. Now, I don't think that's a very efficient system where you've got people coming to the emergency room for their basic health care. That doesn't do a good job in terms of taking care of those folks, and it sure heck doesn't do a good job for us, the taxpayers, because we got to foot part of that bill.
Yeah, but what you're talking about is systems that government has run for years and have not been efficient, that we're now being told that we can use all of the savings from waste and corruption and graft and misspending and misbilling from some of these government programs to fund a bigger government program.
No, Doc, that's not what I'm saying. I'll try to be clearer, but
I'm saying that's the message coming out of most of Washington.
Doc, I can't. You know, I'm a.
Here it is, Senator. Hang on a second. Here it is then. You're saying Medicare and Medicaid, that's been some problems. You're saying those costs keep going up. Then how come you're not just attacking Medicare and Medicaid?
So our private health insurance has been going up at the same rate, in some cases, a higher rate than Medicare and Medicaid rates.
Yeah, I understand that.
Here, Doc, here's what I think we need to do. This is the underlying principle of where I think healthcare reform should head. One is the current system is not sustainable. It's going to bankrupt the government. It's going to bankrupt people who've got private insurance because their costs are going to double. What I think we ought to have is a healthcare system, and as a business guy, financially rewards doctors, drug companies, hospitals, device makers for the quality of the care, not the number of tests you get, not the number of procedures you get, not the fact that you've seen some drug advertised on TV and suddenly you don't want the generic anymore, and instead you get the new high-priced one. I think we've got to bring some financial sensibility to our healthcare system, or otherwise, this is bigger than healthcare. This is about America's ability to maintain economic superiority in the world.
Now, I agree with you there, and I think competition is the key to this whole thing, but I don't think it has anything to do with the government spending more money on it. The government has made mistakes with Medicare and Medicaid. You get rid of Medicare and Medicaid and allow people to fund it themselves. If the government took less of our money, a lot of people could afford many more things like health insurance. And if you're talking true competition, what you're talking about is opening it up and allowing more insurance companies to compete. Get rid of some of the rules governing state to state. We had a situation where a guy in New York, a doctor, wanted to flat out charge $75 a month unlimited care and wasn't allowed to do it.
That's crazy.
It is. So how come we're not talking about that? We keep talking about all these other nutty things.
One other thing I got to tell you, you're pretty bold in terms of advocating getting rid of Medicare and Medicaid. I don't think that's, that's not my position. I think.
Do you think that healthcare is a right then?
No, listen, I think that what we have right now, I know we have folks who say, is it where in the Constitution is healthcare? Well, we don't say education's a right as well, but we've decided as a country that we're going to provide education for folks. Healthcare is not in the Constitution, but we have already decided, independent of this, that if somebody who doesn't have health insurance has been in a car crash and shows up at the hospital door, we're not going to turn them away. If you're saying we should turn that person away at the hospital emergency room door, I mean, that ought to be a proposal. If that's your proposal, I guess it ought to be debated, but I'm not sure most Americans would agree with that.
I don't know, but you know what? I'd take that over what we have right now, Senator. Absolutely. And you know what? I think we do need to pay more attention to what's going on in the Constitution, what's written in the Constitution, instead of just saying, as a society, we've decided, because it doesn't end. Senator, you voted against the increase funding for the Cash for Clunkers.
Right.
And your statement was, where's it going to stop, basically?
Right.
We need to do a national beef for... So where does any of this stop? That's my point. As soon as you take one step, it just goes crazy.
But, Doc, I also got a bill out there that says that where the federal government owns more than 20% of companies, I'm doing this with Bob Corker, a Republican from Tennessee, we ought to put it in an independent trust, and we ought to find a way to get out of government owning pieces of our big companies. I think we need to get back to a free market. But what we also have had, at least, and let's go over now into some of these other activities, I do believe, Doc, as a business guy, that we came very close to the edge, and there were plenty of blame to go around on both political parties, to a total financial meltdown and a collapse of our financial system.
Two wrongs don't make a right, Senator.
No,
I'm sorry, they don't.
Doc, where you and I are probably going to agree to disagree, I didn't like voting for the TARP plan. I didn't like necessarily voting for the stimulus plans, but the alternative of doing nothing, I think, would have been a disaster.
First of all, that remains to be seen.